My name is Brian Anderson, and I am a neurosurgeon at Summit Brain, Spine, and Orthopedics. So I guess a little bit about me, my background. I grew up in Utah, a small town of Deseret, which is maybe 350 people. I grew up in a farming community, farming family. I think that's where my, journey begins. I learned a lot of hard work. I attended Weber State University and graduated with a bachelor's degree in clinical laboratory sciences, which gave me an excellent background for entering into medicine. And I went to medical school at OHSU in Portland, Oregon. Along the way, got married during undergrad, had children. I had two when I started medical school. When I moved away from Utah, my second child was about 6 weeks old. During medical school, had another child. After completing my time in Oregon, I moved to Penn State, where I completed all of my neurosurgical training and had two more children during residency. So after 7 years in Pennsylvania, I began my practice in central Illinois. Along the way, things happen. Business of medicine gets in the way of providing medicine. An opportunity to come back to Utah opened up, connected with Summit, and had some quick conversations, and before we knew it, we were on our way back to Utah. Common question that we get asked is why we chose medicine. Why did I choose neurosurgery? Honestly, it's really hard. I don't think it was ever a single defining moment. I think it was more of a culmination of an awful lot of things. Life gives you opportunity every day. Based on those opportunities, then your tomorrow looks different. I was planning to do orthopedics. That's what I entered medical school having the plan to do. One point, I just kind of had this realization that I didn't think it was necessarily going to be my plan. Within a few days, I had some exposure to neurosurgery and thought maybe this is the piece that I was missing. From then on, neuro is the only thing that really made sense to me. So I think that's kind of how I found my way to neurosurgery. I think probably for a lot of people that know me, which aren't a lot, I'm a fairly introverted person. I like my time alone. I like to think, and I think maybe that comes from growing up on a farm, spending a lot of hours just sitting on a tractor. I like seeing new things. I like traveling. I like seeing the world because it teaches me so much about who I am. If I could kind of pick to be in any situation, probably sitting in a tree stand. It allows me to spend time in nature and hunt, which I really enjoy. As technology advances and it merges with surgery, we're able to do amazing things, and the ability to treat a condition that we couldn't treat 5 years ago is the most exciting thing that I get to do in medicine. While I enjoy doing things that have been done for a long time, I'm much more excited about doing things that are new and that haven't been done before. My practice is maybe a little bit different than the typical neurosurgery practice. I love technology, and I love pushing the limits of where we are today and how do we make this better for all of us tomorrow. As new information comes available, we have to embrace that and be grateful for it and figure out how do we use this to make things better. And it might change the way we think. It might change the way that we've thought about things. And how do we push things to do better than they did yesterday? I think, finding a new way to operate, a new way to think, a new way to practice medicine is what we should all be striving for. There are lots of people involved. It takes all of us. And when we're all working on the same team, the outcomes make it all worth it. And we get to change lives for the better. And, that's ultimately what we're here for and what we stand for.